Grace Cottage Hospital was started in 1949 by Dr. Carlos Otis. He had come to Townshend, Vermont, a little rural community outside of Brattleboro, in 1938 and was practicing medicine here and realized that the community was in desperate need of a hospital. And he really felt that delivering babies in the back seat of a car probably wasn't the right way to proceed into the rest of the century.
The whole community joined in getting the hospital up and going. People canned vegetables, they canned fruits, they donated time, they donated labor. The community has just always been a big part of this hospital, and Dr. Otis always said that without the community it would have never happened.
From the very beginning, people like Mary Plumb, who was the vice principal at Leland and Gray Seminary in town, and Hattie Stratton, Ruth Hines, all donated their homes to help make this hospital a reality. 900 people were here for the opening of the hospital, and he delivered the hospital's first baby the next day on August 8th, 1949.
We had 6 children, and they were all born here. Dr. Otis delivered 4 of them.
Oh, Dr. Otis was wonderful. You have to give the man credit for developing building a hospital such as this out here in the country with not a lot of people. He was very dynamic, very determined to be successful at it, and did a great job.
People want accessibility to their physician. And they have that here, and they have that in this valley, and they have that with this cadre of doctors. They're very accessible.
Very few doctors really sit and listen to patients. They have a lot of diagnostic equipment and they figure out what's wrong because they hook a patient to a machine. But our doctors sit and really listen to what the patient's complaints are, what their ailments are. It's a much different place than a big hospital.
What looks like dealing with someone's diabetes may suddenly turn into how they're coping with their mother with Alzheimer's or something. You know, you crisscross between the personal and the medical and the family and the social, and that's just a wonderful approach. I think that's team caring at its best right there.
We've been down here a number of times for my son, both when he was sick as well as his pediatrician is resident here, so we're here for our regular appointments.
The best part is, though, that even if our pediatrician isn't available, they will always see us in emergency. They will always see us really quickly. They're great. They never give us a hard time for being worrying, silly parents. So that's really nice.
Yeah. It's close by, and it's just it's warm. It's
a nice place to come to.
Yeah.
This little hospital is sort of an innovative little place, and we were the first hospital in Vermont that had swing beds, and we started practicing high-level rehab early on. We were the first place to use thrombolytics and cardiac disease. There's a wonderful EMS service. We have Rescue Inc. on campus. We have very good rescue squads in the local area, most of whom were trained through the hospital system. So we were able to get a critical access designation for the hospital, which means that we can bring somebody into hospital for 3 to 4 days as an acute care patient, stabilize them, and then move them into the level 1 swing bed status where we can work on rehabilitation so that we can get them home safely. That's been incredibly useful to the community. You can do a lot of the basic good medical care right here. But if you come in with your acute heart attack, we have dovetailed the system with the cath lab at Dartmouth so that we use exactly the same tubing that they use, exactly the same form that they use, and exactly the same drugs. So they're actually looking at the same EKGs we're looking at. And then they say, okay, this is what we want you to give them, and the helicopter's on its way. And we get door-to-door time in under an hour for a heart attack, which is exactly what you need to get a successful result. Same thing happens with strokes. Major injuries, head injuries, things like that are immediately, airlifted out.
The reason we came to Grace Cottage was when my 33-year-old daughter was dying, and we had had a history of going to Boston for her whole life for treatment. We felt very, very homey here. We felt very comforted by the smallness and the quietness and just the peace that was here. We could feel it. She liked the comfort of the hospice room itself and the way it was fixed up like a bedroom and not a hospital room. She liked the fact that I could stay right in the next room, and be there all day, all night, and just hop away to get to her. And Bethany was so pleased that we found it. And I was pleased because she was happy here. She felt at peace. And she went out the way she wanted to. And you can't be unhappy with that.
I work in the emergency room, and I'm the first person usually that a patient sees. So when they come into the hospital, they're coming into the emergency room, they're sick, they're ill, they're worried. I take pride in the fact that I calm this person, I immediately assess them and see what I need to start thinking about very quickly. But I also, if there's a child there with a parent that's sick, we take care of the child too. We comfort them. They may be nervous that mom or dad is very sick and what's going to happen, but we make sure that they're taken care of too. Or if the child is sick, we make sure the parents understand that we're going to take care of their child. And we have a local group of women that make quilts for children in the emergency room. And so when a child comes in that's sick, we will give them this quilt, and they look at me maybe twice and say, I get to keep this?
The hospital is a real integral part of the community and has been for the last 60 years. We depend tremendously on over 200 volunteers who come and help us for things like our annual hospital fair day, which is always the first Saturday in August.
The concept was to raise some money to buy things that the hospital auxiliary and the administrator thought were needed. Most of us look forward to it because we just get a chance to talk to people we wouldn't see all year long. People come out of the hills you haven't seen in a year. And they sit around under the maple trees on the common and they chat. And the most wonderful thing is to see the old folks talking to each other and watching the kids play in the pond. It's really an amazing community event.
There's just something special about Grace Cottage. It's a family feeling. Everyone knows everyone. Everyone helps everyone.
It's the family we're treating, it's the patient, it's long-term goals, it's short-term goals, it's the patient's whole life, right then. Everything has some aspect to how we deal with that patient. And we're very good at it, and we all have a passion for this. So I think that's one of the great things about Grace Cottage. It's not a middle ground in your career, it's where you want to be.